And Dr. Sherman, I am curious to ask, what exactly has the makeup of your ICU been like outside of COVID patients? Because obviously there's great stress right now that not a lot of people are seeking care, especially emergent care right now because of
So
this.
that's a great point, Kevin. I think that during the height of the epidemic, at least in New York, at least in phase one, as we call it this now, because we don't know where this is all going, we've had quadrupled our ICU capacity, and it was almost entirely COVID patients. Even patients that probably we would have put in an ICU, especially in a community hospital where there's a little bit of a lower threshold to admit ICU level patients than tertiary hospitals. We were really withholding putting patients into the ICU as the result of not wanting to cross-contaminate patients that are, in a predominantly COVID environment, especially with the staff having to don and doff their PPEs. We didn't close the unit off to just COVID, which would have made it more of a hot zone, as we call it. So we really were trying to balance that. We did have much fewer ICU patients in general than we would have normally seen. Ratios are starting to change. Now that the number of COVID patients in the community is coming down, admissions are coming down, we're seeing more non-COVID patients coming into the ICU, more non-COVID admissions starting to come back. Those numbers are still much lower than our typical non-COVID scenario, pre-COVID, I would say, scenario of our ICU and total hospital capacity for non-COVID, quite honestly.
Wow. And speaking again, like you said, this is sort of a wave that's moving westbound to areas that maybe were not immediately affected, such as the West Coast. Sort of, I guess, a better analogy would be more middling to middle America. Mm-hmm. What advice or what other insights could you share with some of your colleagues in these Midwestern states that are just now seeing the brunt of it?
Yeah, so I would say, for one, make sure that you're adequately supplied. There's never enough PPE, quite honestly. If you think you have enough, you're mistaken, because, as you surge, the number of PPE that you require for constantly donning and doffing throughout your hospital itself is very high. So prepare for that. And the same with ventilator support. There was a lot of conversation during the height of concern around the number of ventilators that were actually out there. I'm lucky enough that we're in a health system that has a very good procurement department and was able to get the ventilators we needed. But to prepare in the scenarios that you may have quadruple the number of patients in an ICU setting that you would have had beforehand, and to prepare with almost all those patients that are COVID positive in the ICU required ventilatory support. And then lastly on that scenario is, as I've said at the beginning, many of these patients still require ventilatory support. And that, I think, was somewhat of a surprise to us, and it's somewhat unpredictable as to who is going to respond and who is not. We see certain patients in a demographic. We had a study in our system that was published in JAMA looking at the demographics of people, and we are seeing a higher prevalence of males that are a little bit overweight to obese, that have hypertension and diabetes, but that is not the only patients that we're seeing that are certainly being admitted and having prolonged stays. So we're still working on the predictive models around who is having a good response and who is not. So the advice to the people in the Midwest is certainly to be prepared. The second part, I would say, is that at least in the New York City area, the social distancing and quarantining was very effective in really reducing the number of patients. Of course, we will see as the situation is changing now, both in New York in terms of easing restrictions and with the rioting going on across the country, and the lack of social distancing, and also with the warm weather and people going in, at least in Long Island, to beaches and other areas, parks, etc. Whether that will change, there's a concern that will cause another resurgence of COVID in the absence of vaccination and any real true effective outpatient therapies. So that said, I would say to the ID docs out there, certainly to get the word out, to emphasize that social distancing and quarantining is effective, and that to really get that message out there, and also wearing masks, of course, as I should have mentioned. The people wearing masks, really, it's not 100% foolproof, but it certainly is had a large positive effect on reducing the number of COVID patients sick with COVID overall. The other thing I would say is to continually work on being prepared. So we were looking at surge plans a month before the surge actually hit us, and we're looking at recovery plans in the height of the surge as we continue to do this. So we were able to build a unit like we have in anticipation of that need prior to actually the need of the COVID numbers coming down. So I would say the more you think through and forward and hear the experience both on the East Coast and also abroad, I think that is helpful in terms of trying to prepare.